Hey everyone, welcome back to my channel. So I'm sitting in the living room. I usually do not shoot here, but there's nobody at home, so it's perfect. And I wanted to do a chit chat video where I get a lot of questions about IVF all the time on my Instagram. And so I thought I'll answer some of the common questions that I get around the IVF process and debunk some of the myths and notions people have about this process from my experience. Again, I'm not a medical practitioner or an expert, but whatever I've learned through this process, and I've gone through this process with Nishka, my first daughter, and my new baby that's gonna come soon. And so I thought I'll kind of share my experiences and learnings through this process. So the first question I get about IVF is, can you choose the gender of your babies? So I know in Asia, some of the countries you cannot do that. Knowing the gender is illegal. In the US, it's a little different scenario. You can opt to know the gender, even when you get pregnant or in the IVF process. So as when you do the genetic testing, you know the gender, and you as a parent can opt to not know. You can tell them and request them that you do not want to know, or you can know the gender. In the IVF process, you are also allowed to choose the gender of the embryo that you want to transfer. It's completely legal and different people have different preferences. In our case, what we did is we told the doctor to transfer the healthiest embryo, and if it was successful, to tell us the gender, and that's what we opted for. But if your question is, can you choose the gender? The answer is yes. In the US, you can. The number 2 question I get a lot is, how costly is IVF? Is it very costly? And the answer is yes, it's super costly. You know, again, costly is a relative term, but in a lot of cases, insurance doesn't cover parts of IVF or the entire process itself. Depends if you are working for a certain company or if your insurance covers it. But overall, it is an expensive process. The average cycle, which includes the retrieval and transfer, costs around 20 to 25K. A lot depends on what your requirements from the IVF process is and what your insurance covers. So the IVF process contains a lot of things like genetic testing, which often is not covered by insurance. And then depending on your health condition, do you need any surgery? What kind of medications you need? There are so many variables and factors that it's hard to give a particular number. But like I said, the average is between 20 to 25K. But always when you go through this process, check with your company on what's covered, what your insurance policies is. There are a lot of IVF clinics which give you grant for IVF treatments. And they also have things like, if you do not have a successful pregnancy in a couple of cycles, they will give you the money back. So check all these factors before you go in and decide what your treatment plan is and what the financial cost for it would be. Okay, I took a quick break because I wanted to compile some of the other questions that I got in my DM in the last few days. Now, the next question that I wanted to talk about is IVF painful? A lot of people ask me before they're going through the IVF process how painful the process is, how many injections you have to take. And I always say pain is a very relative term. Some people have higher thresholds, some people have lower threshold. Also depends on the medication, because there are some medications during IVF which are more stingy. You know, they sting a little bit more than others. So during my IVF retrieval process, I think the injections did not impact me so much. Even during my transfer, the injections were not that difficult. What was painful for me was the progesterone. That used to sting me a little bit. And after a point, the areas I used to take the progesterone were just bruised. It was just bruised, and it was just very painful every day because I was taking it for such a long period, especially in my first pregnancy. I took it up to 10 weeks and it was just a very painful process. But otherwise, the injections really depends on your pain threshold and how your body kind of takes it. I wouldn't say it's an easy process, you know, let me put it this way. And especially if you're going through multiple cycles, it's a little harder, but it's not that bad as well. And I don't like to say that because, like I said, everything is relative. For me, the progesterone was a little troublesome, but everything was a little okay. Now, when you talk about pain of the egg retrieval or of the embryo transfer, that's as well relative. For me, the egg retrieval, I was put under, so I did not feel anything. When I woke up, there was a little bit of discomfort. Wasn't pain, there was a little bit of discomfort, but overall I was okay. I know some people who have a lot of eggs, you know, they have something called OHSS, which is a possible complication, and that makes it a little difficult. So definitely chat with your doctor on how your pain thresholds are, and how your body reacts to medication, and the entire process. They will sit with you and kind of explain you the different scenarios. For embryo transfer, it's a very straightforward process, so I did not feel anything. It was very easy. They actually gave me Valium or painkiller in the morning to ease my body up, and that really helped. I personally did not feel anything during my embryo transfer. So another question that I get a lot on the IVF process is, does genetic testing guarantee successful IVF? So I have shared before that we genetically tested all our embryos. We did the PGT testing, and we did that because we heard that does increase your chance of getting pregnant. Just because the embryos are genetically tested, they have a higher chance of viability. But again, just like the IVF process, nothing is guaranteed, right? You can have the best embryo quality, genetically tested everything, but if your body is not receptive, it's not going to happen. Genetically testing, it gives you some relief that the embryos are genetically viable, and it kind of minimizes the chance of any failure due to genetic issues. That's all it does. It does not guarantee any success. Chat with your doctor about it. They will give you a better idea, but we did do PGT testing and genetically tested all our embryos. The next question I get a lot is, does IVF have a long-term impact on health? Again, I don't like to answer such questions because I'm not a medical expert. I cannot answer what the impacts are, but it's a conversation I did have with my doctor. I did speak to them on the long-term impact, and they very clearly told me on what to expect and what not to expect. I'm not going to go into the detail of it. It depends a lot on how many cycles you go through, the kind of medications you take. Everything has a side effect, and everything has a pros and cons to taking it, depending on your risk factors and your body's receptivity to medicines. In my case, the risk seemed very low and minimal. The long-term impact also seemed low. I was very comfortable with the process. As far as I know, I don't think there was any massive risk that I was taking by doing the IVF process. I think the pros just outweighed any cons that it might have held for me. And I was just very comfortable with the process. Internet, social media, Facebook, bloggers like us can only share our experiences. We cannot know the specifics of your health to advise. So I always say that take it with a grain of salt, and always consult your doctors on anything related to medical issues. The next question, and I want to address this because I get it a lot. I had posted my IVF journey on social media. When I first shared it, I got a lot of comments. Some were nice, supportive, and there were some that were very skeptical, and they were like, why don't you just adopt? And I really want to address this because this always comes up with everybody who goes through the IVF process and chooses to be transparent about it and talk about it. Why don't you adopt? Why are you spending so much money? So I want to say adoption's got nothing to do with wanting to have kids biologically. It is two very different things, right? You can even tell a person who's trying to conceive naturally, why are you trying to conceive naturally? Why don't you adopt? There's so many kids who need a family. So adoption has got nothing to do with wanting kids biologically. So if someone who's going through the IVF process or surrogacy or any form of fertility treatment or solutions, please do not tell them adopt. Everybody knows that's an option. Everybody knows it. It's when they are comfortable with it, when they are open to it, is what matters. I think adoption, you can adopt a kid even if you have 10 kids. You can adopt a kid even if you have no kids. It's a very, very different issue. It's a very, very different ball game than deciding to opt for a fertility treatment. Everybody has their preferences. Everybody has their desires, and we cannot blame a mother for trying all the solutions that she has, and we cannot blame a mother or hold her or make her feel guilty about trying to resort to those fertility methods, because going through the pregnancy process and having a kid in itself is an experience which a lot of people may want to experience. Again, there are a lot of people who don't want to experience, and it's a very personal choice and very personal decision. And you have to let people make decisions on their own, how they want to be mothers and how they want to go that route, whether it's through natural conception, whether it's adoption, whether it's surrogacy, whether it's IVF, it's IUI. It's a very personal thing, and it's something that I feel like whenever you have a conversation, please be sensitive, because you never know what someone is going through. And as far as the money is concerned, why are you spending so much money? I think that's again a very personal thing. People have their priorities, they have their dreams, and wishes, and we cannot compare money a lot of times to emotions that are involved in parenthood. Okay, so the next question I want to address is that if you do IVF, you'll always have twins or triplets. Not true. I had that misconception as well when I started my process. The reality is, having twins and triplets, yes, there could be a higher chance during IVF, but not all the time. What my doctor told me from what I have learned. But having twins and triplets has got a lot to do with two things. One, how many embryos you transfer into your body, and two, age. The maternal age matters a lot. So a lot of women who have IVF or try to have kids later in age, even if it's natural conception, your risk of having twins, triplet, or multiple kids just increases as a factor of your age. It's got nothing to do with IVF as per se. And the second thing is, traditionally, in a lot of the IVF cases, people used to go only for fertility challenges, severe fertility challenges, and at a much later age. And that time they would just kind of transfer 2-3 embryos to see which one the body picks up. And what happens sometimes in those cases, 2-3 embryos stick and you end up having twins or triplets or more. And that's what used to happen. In today's day and age, they will only transfer 2-3 embryos if there's a medical need. In our case, they only transferred 1 embryo at a time. There's always a risk it could split depending on your age and risk factors, genetic history, and all of that. But if you're trying to equate IVF with having multiple kids, that may or may not be true. So I think that's something that you will have to discuss with your doctor. As far as I know, that it's got more to do with risk factors, age, and genetics rather than IVF as per se. And the last question that I want to address before we end this video is, IVF is only for old people. I have gotten that comment a lot on my videos that you're doing it IVF because of your age, and I do not think that's true. IVF can happen for a lot of reasons. Through this process, when I started IVF, I met a lot of people. A lot of people shared their stories with me. Today, women are choosing their career, desires, profession, a lot of factors. Today, women are choosing a lot of other things over starting a family early on. So obviously, age is a factor. Biological clock, like I said, is real. So women who are opting at a later age, of course, sometimes there's a need for intervention, medical intervention to have children. There is no doubt about that. But in a lot of cases, that may not be true. A lot of women who want to pursue other things in life, or do not know if they want kids, or are not sure if they want kids, they end up going and freezing their eggs or embryos, whichever suits the scenario, so that in the future they don't have to worry about the biological clock because they have options. So a lot of people, professionals I know, they freeze their eggs and embryos and then decide whether they want kids later on or not. I have some friends whose spouses are in the military or are veterans. They are away from their spouses for a long period of time, and the only way to conceive is through the IVF process because they don't have enough time to try naturally. So there could be a lot of factors, and I always say, don't jump to conclusions when someone is going through the process. Be kind, be empathetic. It doesn't hurt to be kind. We don't know what someone is going through, so let's be kind. And I hope this video kind of answered some of your common questions around IVF and debunked some of the myths or things that you would have heard people saying but may not be true. And if you're thinking about opting for the IVF process, I hope this video gave you some clarity. Today was a no makeup day, so I have not put anything. I'm just wearing a maxi dress because my tummy is growing a lot and I'm just in that zone where I just want to nest and be comfortable. But I really wanted to chit chat with you guys and kind of make this video because it's so important. But I will see you in more videos. But till then, I'm gonna just get some decaf coffee, rest, and I'll see you next time. Till then, lots of love.